We are Ethan Twining, Kara Williams, and Mason Walker, and we chose to analyze the psychological condition suffered by Pat Solitano, who is portrayed by Bradley Cooper in the movie Silver Linings Playbook. Pat Solitano is introduced as a man recently freed from his stay in a mental hospital, a sentence that he earned by assaulting his ex-wife's lover in a romantic fit after catching them having an affair. After being released, Pat goes to live with his parents and begins his obsessive quest to win back his wife. We've diagnosed Pat as suffering from bipolar disorder, more specifically bipolar 1. Disorder is characterized by manic highs and depressive lows, with bipolar disorder being the most severe form of the condition. Bipolar patients experience inflated self-esteem, decreased need for sleep, restlessness, and flight of ideas when in manic episodes, and the opposite in episodes of depression. Bipolar disorder is a mood disorder in the DSM-5 categories.
Two symptoms of bipolar 1 disorder that Pat shows in the movie are increased activity and restlessness. We see increased activity when Pat starts working out when he first goes to the psychiatric hospital. His friends and family make numerous comments about all the weight he has lost, and he partakes in daily running. Restlessness, Pat wakes up his parents multiple times in the middle of the night because he's obsessing over Nikki, who is his wife, and he cannot sleep. The missing symptom, Pat does not show any sort of signs of wanting to hurt himself. Part of this could be because he has a false sense of superiority over his family and the man his wife cheated on him with. Possible treatment for bipolar 1 disorder, the first is, depending on the severity of the episodes, many patients could be hospitalized. Pat was in a psychiatric hospital for 8 months. Therapy is also used to work through the symptoms of bipolar disorder, and we see that when Pat has multiple sessions a week with his therapist. And medication can also be used to try to help control the mood swings. We know that Pat takes medication because he had a discussion with Tiffany about all the different medications that they both have taken.
It is important for Pat to utilize both medication and therapy in order to help him gain a greater understanding and control of his mood swings. However, some people view medication as controversial because they don't think the medication will actually help their disorder. This film was overall a fairly accurate portrayal of bipolar 1 disorder. All of Pat's activities could be described as symptoms that are typical of a person suffering. However, the film does somewhat romanticize his disorder by showing an improvement in his personality as he works more and more with Tiffany, instead of while he continues to work with his doctor. He also tries to manage his disorder through sheer willpower, which is a largely ineffective method. We used a variety of sources, including our Psychology, Perspectives and Connections book, various medical websites, and the movie.